Minister, I'd like to congratulate you on progressing this legislation, which I know was a commitment in the programme for government, and I think it is very welcome for particularly rural communities, farm families, for people with businesses. And the Fair Deal scheme has been successful, I would say, and absolutely very important and vital in providing community care settings for people. And it has been, as you know, Minister, criticised in the past for probably the difficult to qualify and for the numbers that are on it. And it is a sad fact demographically in the country that our population is ageing and the care burden is going to increase. And what is also salutary for all of us to consider is that our family sizes are getting less. And I think it would have been traditionally recognised in Ireland that the care for elderly parents would have fallen onto sons and daughters, and they might have shared that burden, and indeed they do every day in this country. But there are less of those coming through, and the burden of care is getting greater. And also, thankfully, we are also living longer, but that means we have different needs at different stages later in life. And so we must look to continue to try and enhance community care and elderly care and residential care, and that also extends right across the other spectrums of population that are implicated in that, particularly I would say the disability sectors. So, as I said, Minister, I welcome this legislation, and I hope it will certainly go to improve it, but it cannot go far enough, I would say, in trying to expand it. But it is also a case in the country that every sector of the economy, particularly every sector that is providing a public service, is looking for more money. And there is not endless money to go around. So we need to prioritise where we should spend money, and we also need to create efficiencies in the provision of public service spending. And I believe that's an area that we have probably taken our eye off the ball on in this last year of crisis. And certainly at the end of this crisis, we are going to face very significant challenges to the public exchequer payroll. And we are going to have to get really down to the minutiae of how we are spending our money and what we are getting for that spend. I think it's also a fact that people would like to stay living at home longer where possible. And I would hope again, Minister, that you would look particularly now at new technologies, and there are a lot of technologies which are allowing people to carry on home life for as long as possible. I know of very few people that would be rushing into nursing homes if their quality of life was such that they could remain in their own place. And I think most of us would like to remain in our own place as long as possible, but we can see now where technology advancement is going, particularly in home monitoring systems, which have revolutionised the care of people at home. And I'm aware, certainly in rural areas in County Waterford, and even relatives of my own who have been facilitated to spend longer in their elderly years because of home monitoring systems. And I think these should be looked at. And I'm not sure I know there are grants available for that, for those that are challenged, Minister, but I think again, we should look at spending more money in this area rather than trying to divert people into community settings where they will cost an awful lot more and the care burden will be there. The other thing I would like to point out is, particularly in terms of COVID, the reaction of both the private and public sector in terms of community care of the elderly in particular and disability. But we know that COVID, when it came into the country, the main danger of COVID was that it was targeting the elderly, and we saw all of the problems. I'm not going to rehash those that we had in terms of elderly care people finding themselves possibly in settings where they were at risk. But I want to give a special shout out here to the health service in general, and particularly those in the residential care settings, for the Trojan work that they have done, Minister, over the past 12 months, and they continue to do. And with that in mind, government announced last year that they would give a temporary assistance scheme to nursing homes, particularly to the private sector. And we know that 80% of the burden nearly falls on private sector nursing to support their costs. And that was done at the outset to provide for PPE in the main. It also went to support isolation space, and it went also to help with recruitment. And those challenges have probably abated somewhat, but the money is very required. And at present we are operating guidelines, visiting guidelines within the nursing homes, and they are being facilitated, Minister, by the temporary payments, because people have been brought on to act as visiting coordinators, because we're trying to check people coming in whether they're vaccinated. We're trying to ensure that those that they're coming to visit have obviously been vaccinated, but how they are, what setting they're going to see them. Are they going to see them in their room, which is the protocol, or can they be seen outdoors? And we need people to manage all of that. But essentially, I understand that this scheme is soon to come to a finish, Minister, and I wonder what government's thought on that, or how you're going to continue to support nursing homes to continue these COVID protocols without that money. The other thing that has been going on in nursing homes for quite some time is the HSE and HSA, where outbreaks were occurring, were doing screen testing after the outbreaks. And again, I understand that now is going to be stood down soon. Essentially, I think the HSE has taken a position that where 80% of staff are vaccinated, these testings are going to come to a finish. And I think, again, we have to be mindful that we have vulnerable people there. Happily, I think we've done very well on the vaccination front, particularly for the elderly. We know that everybody in those settings should now be vaccinated, but we still have to imagine that there's risk where there's temporary staff maybe cycling through those, that they risk carrying an infection potentially from one facility to another. So I'd ask you again, Minister, just to have a look in terms of that money. And beyond that, I'd also talk about the supports that are there. And I was on COVID committee, and the issue of nursing homes and congregated settings came up quite a bit. And there was a massive bias, if I may say at times, on the committee in favour of public nursing homes versus over the private. And private was often presented as purely for profit. And I don't think that's a fair representation. I know a lot of people in private nursing home business, and they are excellent carers of the elderly. But I point out to you, Minister, that in the private care setting, there are people in there who get €1,000 a week support into the private. But in the public, those supports can go up to €1,500, €1,700 and €2,000 per week. So for providing exactly the same care, we make a difference in this country, and we decide to support public costs more than private. And yet, as I said to you, nearly 80% of the care in the sector is provided by the private sector. So that doesn't make sense to me, and it tells me that there is an inequity there, and it needs to be looked at, because it's very hard to stomach talking about the lack of adequate care in the private sector if we're going to pay them 50% less for doing the same job. And I think that's something that needs to be looked at. And just as part of all of that too, Minister, you would be aware of the expert panel, the review panel that was convened to look at all of the issues in nursing care. There was 84 recommendations made within that report, and perhaps you'd return to the House at some point and provide an update on where those recommendations are and how many of them have been acted upon or implemented upon. One other thing that's been topical recently in the media, and it's been topical for some time, is the issue of rapid testing. And I'm on the record as saying that I brought rapid antigen testing to NEFIT. I gave it to NEFIT in May of 2020. And to date, we still have not implemented antigen testing, Minister. And in actual fact, we've had the recent debacle where we've had a senior person in NEFIT coming out describing rapid antigen testing, which is approved by the CDC, which is the Centre for Disease Control, as snake oil. I think that's more than regrettable. I believe it also shows a medical bias. Now, I have engaged over the past 14 months during COVID with senior specialists, and some of those were using antigen testing informally in hospitals to try and guide COVID pathways in their own hospitals because they didn't have beds. And despite that, those doctors were more than happy to use it and reported 100% success in identifying people who were in danger of transmitting disease. The HSE appears still, under NEFIT guidance, to have taken a guideline that they are not going to use antigen testing, or they are very slow in adopting it. And I'm sure I know Minister Donnelly, certainly when he was in the COVID committee, was supportive of rapid testing, and I think he has probably moved base slightly in the last few weeks. And I heard Dr. Holohan describing the Cochrane report as saying that the antigen tests were only effective 50% of the time. That is absolutely not the case. It depends on what you're measuring. They are actually effective 100% of the time when detecting transmission levels when you were in danger of transmitting COVID. And we are in the situation in the country now where we are trying to figure out how we are going to open up the economy, how we are going to get aviation back some way operating in this country. We have a proven test, which in America they have done over 300, testing on over 300,000 antigen tests, and the rate of false positives was 1 in 10,000, and the rate of not detecting virus at a high load was 0. And we're still trying to figure out how are we going to do this. We had Professor Mark Ferguson from Science Foundation Ireland at the behest of the Taoiseach undertake a report on antigen testing and ask for it to be introduced. And when he was asked how many departments had engaged with them, actually only one, which was the Department of Higher Education, where Minister Harris was looking at antigen testing in the back end of the year for the reconvening of university. So I would ask you, Minister, on top of this legislation, to please again go back to the department and to have a look at this issue again. And the other issue that was brought up recently at the Health Committee was the issue of vitamin D supplementation. And there is a huge body of evidence internationally suggesting the major benefits that can be found by supplementing vitamin D, but it doesn't happen overnight. In order for people who are low vitamin D, and we are all low in this country because we live in the northern latitude, none of us are out enough, and certainly maybe up to, from these months on, we will get adequate amounts of sunshine to generate vitamin D, but we haven't up to now, and we should be supplementing it. It's a very cheap fix for a lot of problems. Vitamin D has been well regarded and well known in its immune supports over years, the benefits that it gives to the immune system. And I have spoken to a number of doctors who have been using vitamin D and who have been using vitamin D deficiency as a marker in determining what patients will have adverse outcomes from COVID. And some of those gave a presentation to the Health Committee, and indeed the Health Committee, to be fair, produced a very substantial report on the benefits of vitamin D. And despite that, we cannot get NPHET to make any public pronouncements that the people in general in this country should be supplementing. It is cheap, and there's a small amount of people, different patient cohorts in the country who would need to watch what their vitamin D levels are, and they can do that in conjunction with their GPs. But the other levels that are being spoken about for the majority of the population are absolutely no way dangerous and very beneficial. And yet that message has not got out, I believe that it has been obstructed in getting out, as has the message of antigen testing, which I believe too has been obstructed by NPHET. I don't know why. As I said many times before on the record in the House and in committee, it has been used widely everywhere. But I would say we now have to really seriously look at our economy and how we are going to revive it. And thankfully, we are making good progress now on the vaccination front. But we are still going to need rapid testing, and we are still going to need ways of screen testing in case of future outbreaks, potentially of other variants, and antigens will have a part to play in that. And I would ask you, Minister, to take that message, please, back to the health seniors, back to NPHET in particular. Not that they're listening to me, by the way, nor I think are they listening to the wide body of science or other medical opinion outside of what's in their own think tank, and that has been a problem for quite some time. But I'd ask you to take that message back. With respect to the legislation today, Minister, well done again. I congratulate you on it and I welcome it. Thank you.